This program is brought to you by your Carolina Ford dealer. Get a fun-to-drive Ford with impressive fuel economy, great technology, and so much more, all for zero. Hurry into the Sign and Ride event at your Carolina Ford dealer today.
Hola, North Carolina. The Mexican consulate held a cultural event, Raíces. This exhibition was held from a Mexican artist, Cornelio Campos. He actually exhibits his art through culture, tradition, and the positive influence that the Latinos have in the United States. Let's take a look at what happened at the event. Here we have Mexican artist Cornelio Campos. He's going to be telling us a little bit about himself and his art. Hola Cornelio, how are you?
I'm doing fine, thank you.
Cuéntanos un poco sobre cómo comenzaste a pintar y por qué te encanta tanto.
Bueno, comencé a pintar desde que tenía 8 o 10 años. Fue cuando fui expuesto al arte y me fascinó. Para mí lo más remarcable ha sido el comienzo y emigré a Los Ángeles después de algunos años, cuando terminé mi preparatoria, tenía 18 años. También tuve la oportunidad de pintar. Entonces me moví a Carolina del Norte, dejé de pintar por un buen tiempo y comencé a pintar como en el 2003, 2004 y como ven aquí tienen los resultados de mi volver a pintar.
So Cornelio is actually originated from Mexico, and he started painting when he was around 8 or 10 years old, and then moved to California, did a little painting there, took a pause in his lifetime, and came to North Carolina and did a little bit more painting here.
En primer lugar viene de mis raíces. Cuando digo mis raíces, estoy hablando del área donde nací y el arte y cultura, los colores, los diseños, creo ha influido bastante, pero también ha influido a artistas reconocidos. Desde luego tenemos a los grandes muralistas, que es José Clemente Orozco, Siqueiros y Diego Rivera, creo ha influido bastante. Pero también en mis temas políticos uso mucho la influencia de Salvador Dalí y otros artistas, pero creo que son los más remarcables que tengo.
Cuéntanos un poco sobre la influencia cultural que tienes.
La influencia cultural que tengo es más que nada de, como decía, de mi origen. Entonces, siempre trato de enseñar un poco o más de mis raíces, pero lo hago con el fin de educativo, dijéramos, porque así como yo tengo curiosidad de otras culturas, también quiero demostrar lo que tenemos de donde yo soy.
Cuéntame un poquito sobre la pintura que tienes atrás de ti.
Bueno, la que tengo aquí enfrente viene siendo cántaros, y estos cántaros son muy comunes, los usamos diariamente, ya sea para acarrear agua o para preservar agua, y los colores a mí me atraen bastante, esos colores llamativos. Entonces la mayoría de mis pinturas siempre tienen colores muy vibrantes. Entonces este sería el ejemplo perfecto para mí de algo que quiero demostrar y que estoy orgulloso de demostrar del lugar de donde vengo.
Hola, North Carolina. We want to invite you to see what happened at the CELA event at UNC. Dr. Aleman and Dr. Crockett are going to be telling us about the program and more information. Dr. Aleman, can you tell me about the program and when did it start?
Well, CELA began in 2008 here at UNC, and we really want to promote the education, research, and the patient care to Latinos of all North Carolina. We really think that we need to promote health for Latinos. I think we're about 9% of the population. So we're looking at creating help not only here, but also looking to serve those throughout the state in various ways, so outreach programs, maybe something in the websites and things like that.
Thank you, Dr. Aleman. Dr. Crockett, I hear you speak Spanish.
Sí, hablo español un poquito y tenemos una clínica en gastroenterología donde veo pacientes hispanohablantes. So I have had a Latino GI clinic since I came to UNC in 2008, and I've had Spanish-speaking patients in my clinic since residency earlier than that. We have a cadre of bilingual and bicultural providers, and we try and provide a native language experience for the patients from door to door. So when they walk in, they have clerks that speak Spanish with them, and the provider speaks Spanish with them. And then when we're checking out, they also have staff that can speak Spanish with them. So we really try and provide a seamless experience for them.
Here we have Dr. Royland. He is one of the founders of CELA, and he's going to be telling us a little bit about that. Hi, Dr. Royland. How are you?
I'm well today. Thanks for coming.
Thank you for being here. Can you tell us how CELA started?
CELA started several years ago when we realized that we could be doing things a little bit better in terms of meeting the needs of the changing population we have here in North Carolina, and really giving patients an experience of bilingualism and being able to receive their health care in their preferred language. CELA has some great partnerships within UNC with an educational program that Dr. Marco Aleman and I started several years ago called Campos. And Campos is really just a program to be sure that we are also training tomorrow's healthcare workers to meet the demographic needs of our state, you know, the bilingual providers, and making sure that we have the workforce that we need to take care of the communities and patients that we have.
Aside from Campos, there's another program called Nchcc, correct?
That's right. And Nchcc is really an initiative within our a large research center grant we have. And one thing that we know is that Latino communities, especially in the southeastern United States, are not always included in research studies. And for the research to really be relevant to these populations, we need to be sure they are included, be sure the research studies are something that is important to the communities, whether it's diabetes or cancer screening or asthma. We need to be sure that those studies really represent Latinos as well.
Welcome back, North Carolina. Here we have Dr. Flower. She is a pediatrician at UNC, and she's going to be telling us more information about Gala. Hi, Dr. Flower. How are you?
I'm good, thank you. How are you?
I'm doing well. Thank you for being here with us. So can you tell me a little bit about Gala?
Yes, so CELA is the Center for Latino Health at UNC in Chapel Hill.
And can you tell me a little bit about the integration?
Yes, so as we mentioned, I'm a pediatrician at UNC in Chapel Hill, and we're really excited that CELA, or the Center for Latino Health, has become part of our department in pediatrics at UNC, and we're looking forward to working with them really closely to help improve services for families.
Are you working directly with Latino patients?
Yes, we have many Latino patients who we see in our hospital and our clinics. We're looking forward to working closely with CELA in our clinics for children and families at UNC. They have a long history of providing adults with help at UNC, and we're looking forward to having them help us more with resources and communication and education for families.
Thank you, Dr. Flowers. There is a message that you would like to give out to the Latino community.
Sí, estamos muy preparados para servirles a todos ustedes en UNC. Gracias.
Here we have Dr. Steiner. He's going to be telling us a little bit about the transition of CELA into the Division of Pediatrics. Hi, Dr. Steiner. How are you?
Hi, thanks so much for coming today and asking about it. So CELA has been a program at UNC for about 8 or 9 years now, and we're lucky in the Division of General Pediatrics and Adolescent Medicine that over the past year they've transitioned their work from being in another center to being in our division. We're excited about this because we hope that we'll continue the great work that's been going on across the healthcare center, but also be able to integrate more and serve the families who are getting care for their children at UNC.
Here we have Dr. Ferris. She is a pediatrician, and she's going to be telling us a little bit about herself. Hi, Dr. Ferris. How are you?
I'm fine. Hello, everybody. Good to see you.
Dr. Ferris, can you tell me about your career here at UNC?
I have been at UNC for the last 15 years. Before I came to Carolina, I was in San Diego and in Texas. So I've been in 3 states of the country, serving Latinos everywhere.
And can you tell me about your experience working with Latinos?
Well, Latinos are my people. But Latinos are very different in every state. For example, in our state, we have most of Latinos are new immigrants with less English skills, but a lot of our culture is still in their hearts. Whereas in Texas and California, a lot more acculturation, a lot more English influence, American influence in their lives. CELA is a very interesting program. I've been involved with them almost from the beginning. I was the first doctor for children that worked with them. It is important because their mission and their vision focuses not only on providing good quality services to Latinos, but also educate people about what Latino health is and educate the community about how to serve not just Latinos in the UNC, but Latinos in the state of North Carolina.
And do you see any future goals for this?
Well, we're actually having a meeting today precisely for that. What is our next 10 years going to look like? How are we going to serve not just the families here, but even extending to their families elsewhere? So the next 10 years, 15 years are going to focus on how to be efficient with the resources we have and how to move our community, not just UNC community, but our community or state into a great state of health for Latinos.
Well, we look forward to seeing you in the future, and thank you so much for being here with us.
It's our pleasure, and thank you for covering this.
Thank you, Dr. Ferris.
Good to see you.
Good to see you.
Today on the show, we have Carlota Santana, who is a professor of flamenco at Duke University, and he's here to tell us a little bit about it and about the origin of flamenco and also what's going on in the area with flamenco. Welcome to the show, Carlota.
Thank you.
So, Carlota, tell us specific about the event tonight. Why here? Why is it so important with the stage, the type of stage you have tonight?
Estamos ahora en Motorco, es un sitio de música aquí en Durham. Lo más importante de este sitio is it's an old café cantante where flamenco began in southern Spain. So you see behind us dancers working and studying on very good wooden floor. We actually brought in some extra plywood to have it sound especially good tonight. And we're trying to show what it was like in the 1850s in southern Spain.
You have done other events here in the area, right?
Right. As a member of the Duke faculty, we performed at Page Auditorium and we performed at Reynolds Auditorium.
And why is it so important for this event tonight with the stage? What is the big difference that you need this stage to make it better?
What's most very exciting about this for us and for the audience is that the audience is very close to the dancers, and the dancers are also very close to the audience, and they can feel each other. The audience can feel the dancers' emotion coming out, and the dancers can feel the audience excitement, and it makes the production even that bigger and better.
So tell us a little bit about the origin of flamenco.
Flamenco started in southern Spain in an area called Andalusia. And it's a mixture of actually four cultures. It's a mixture of the gypsy culture. The gypsies came from the northern part of India, traveled all over Asia and Europe, and ended up in southern Spain. We have the Spanish culture, of course. We have the Moorish or Arabic culture that lived in southern Spain for many, many years, and the Judaic culture. And those four cultures in the old days, and nobody's exactly sure what the date was, but lived together and shared their art form and their culture, and out came this art form and this mixture of cultures that's called flamenco.
Cuéntanos entonces del instrumento que usan en el flamenco.
Bueno, uno de los instrumentos es estos. Son castañuelas. Y en la derecha se toca con los cuatro dedos, 1, 2, 3, 4, en la izquierda con estos dos. Lo que se hace es que intentar hacer los dedos ir tan rápido como se puede y se hace así. 1, 2, 3, 4, 5. 4, 5, 1, 2, 3, 4, hasta que se hace ese ruido. Castañuelas.
Wow, impresionante. So cuéntanos, does this all the dancers use these?
We're going to do the first dance this evening, and this is a kind of a folk dance that's become a flamenco dance. It's called Sevillanas, and all the dancers will use them.
Tell us how long have you been in the United States doing the flamenco?
Oh, wow. Well, I'm very happy to report the following, that my company is 30 years old, and we're the first United States flamenco company to celebrate 30 years. So we're very excited about that. We do lots of touring throughout the United States. We do lots of promotion like we're doing here. We do lots of arts and education work. We're in the schools all the time.
So Carlota, tell us, why do you do this?
Why do I do this? Well, for me, flamenco has given me a way to express myself. Flamenco is very universal because we all have the same kind of feelings, happy, sad, angry, whatever. You can express that in flamenco. So it's given me a vehicle for really expression. And aside from that, sharing this with lots of people is very important to me because it's done so much for me. I feel like I can give it to other people and it can do that same thing for them. We're a non-for-profit company. We are supported by National Endowment for the Arts. Duke University has actually done the financing to have us here this time around. And we do lots of educational programs, too, with students.
And where can people go to find more information about this?
We are on a website, of course, www.flamenco-vivo.org. And we have a couple of different phone numbers. We have an office in New York and an office down here. And the office down here is 919-479-9940.
If you want any more information, just follow the link to the website or make a call. This Latino Leader segment is brought to you by your Carolina Ford dealer. Get a Fun to Drive Ford for $0 during the Sign and Ride event at your Carolina Ford dealer today.
Hola, North Carolina. My name is Edgar Lobaton, and I'm an assistant professor in the Department of Electrical and Computer Engineering at North Carolina State University. So let me tell you a little bit about myself. First of all, I came originally from Peru. I spent about 15 years there. After that, I moved here to the States. So my dream was always to do something related to robotics, but I didn't know how to do it. And I figured actually electrical engineering, it was something that I really didn't understand that much about. So I went for it. I decided to learn as much as possible about electronics, electrical circuits, and electrical components. As an undergraduate, I went to Seattle University, a small private university. But then I realized that I actually really liked doing mathematics. And that's actually how I got introduced into what is called research. What happened is that I was walking down the corridor at my university, and then I saw a sign about an opportunity to do research in Puerto Rico. So I had no idea what research was, but the idea of spending a summer in Puerto Rico was really tempting and attractive. So I decided to go ahead and do it. I signed up for it, and actually it was a very intense and enjoyable program. So that was a great experience. That really made this connection, I guess, on my head of doing mathematics, the ocean, the beach, and enjoying things, all of that together. I ended up going into the electrical engineering and computer science department at Berkeley, and I finished up my PhD from there. I worked on several areas, some of them related to what is called computer vision. So that's basically teaching computers how to see the world, how to understand it by using regular camera inputs. And then also some applications related to what is called sensor networks, putting sensors all over the place and figuring out how they get to talk to each other so they can give you a big picture about what's happening. There's a lot of different applications, and some of those applications had to do with security, some of those applications had to do with search and rescue, some of those applications have to do with health monitoring, and even like monitoring of the environment itself. And at North Carolina State University, I started doing or working on my own applications. And I've been here for about 3.5 years now, working on applications ranging from robotics, sensor network, to what is called signal processing. So what we are doing is that we're developing sensors or helping develop sensors and the processing behind it, the brains behind it, to be able to take images and be able to recognize those footprints. So what I really love about my work is actually a couple of things. So one of them is the fact that I get to choose the kind of projects that I work on. But those are projects that I really choose myself and I get to enjoy working on. So to be able to be successful in a career like mine, like what I needed to learn is to figure out basically what options I had at any given point. And to be able to learn about those options, it really helped me to do two things. To be able to get in touch with other people like me that were really interested and eager to learn, and to be able to have mentors. Mentors that can actually guide me through, tell me about all these options that I had, and tell me about how exciting their work was at any given point. Para ser exitoso en mi carrera, lo que tienes que hacer es poder entender cuáles son tus oportunidades, cuáles son tus opciones. Entonces, la forma como yo lo hice fue a través de dos diferentes métodos, ¿no? Primeramente, fue conociendo a otras personas, otros estudiantes que estuvieron en la misma situación que yo estuve, y conversar con ellos acerca de las opciones que ellos estaban buscando y los intereses que ellos tenían. Y el otro aspecto fue el encontrar mentores, ¿no? Los mentores son personas que te pueden decir acerca de las opciones que vas a tener, y también los diferentes tipos de proyectos y todos los diferentes tipos de ideas que ellos tienen y qué tan exitoso y también interesantes son los proyectos en los cuales están trabajando.